You're tested positive for pregnancy, something you wanted all these days, and you're in cloud 9. But suddenly, you experience a vaginal spotting or a mild bleeding. You're concerned. But please do not translate every vaginal bleeding that happens in the first trimester, that is the first 12 weeks of pregnancy, into an imminent miscarriage. Most of the times, vaginal bleeding in the first trimester of pregnancy do not pose to be a big problem. The pregnancy still continues the normal way. But of course, we have to rule out certain complications which can present as vaginal bleeding. The first and foremost concern is a miscarriage. 15 to 20% of any pregnancy in the first 12 weeks of pregnancy can miscarry. But many a time when we do a scan, we find there is a small bleeding that is happening near the placenta called the subchorionic hemorrhage, and sometimes no reason is detected at all when we term it as threatened miscarriage. In either of these cases, the pregnancy still continues to go the healthy way. The second important complication that we would like to rule out is an ectopic pregnancy, but it is much rarer than the miscarriage. In an ectopic pregnancy, the implantation of the embryo happens outside the uterus, commonly in the tubes, as we commonly hear it as tubal pregnancy. Patients at increased risk for having this ectopic pregnancy are those who have had a previous history of ectopic pregnancy, any previous history of tubal pregnancies, or any previous pelvic surgeries. And the third is a very rare complication called the molar pregnancy, wherein instead of the normal embryo, an abnormal tissue is formed. But sometimes the bleeding in the first trimester, a vaginal bleeding, could just be as a result of implantation of the embryo inside the uterine lining, could be because of a simple vaginal infection, or a growth, a fleshy normal growth from the mouth of the uterus called the polyp, or very rarely, a bleeding from the urinary tract can be misinterpreted as a vaginal bleeding. But if you're experiencing a vaginal bleeding in the first 12 weeks of your pregnancy, kindly meet your doctor, who would perform a clinical examination on you, do an ultrasonogram, and if required, a beta HCG level.